call to order the meeting of Danville City Council. Madam Clerk, call the roll.
Reverend Campbell.
Here.
Mr. Gilstrap.
Here.
Mr. Jones.
Here.
Vice Mayor Luther.
Here.
Dr. Miller.
Here.
Mayor Saunders.
Here.
Mayor Mr. Raleigh.
Here.
Mr. Shanks.
Here.
Mr. Toma.
Here. Please stand and remain standing for the invocation and the pledge to the flag. Given by Dr. Miller.
I saw a man today in my office who's an out-of-work construction man, a young man who has 3 children, is having difficulty making ends meet. He's trying to give up smoking, so he'll have enough money to pay for his medicine. So we just have to remember why we are here. Dear Lord, please help us remember that we represent all the people in Danville, the young and the old, the rich and the poor, the weak and the strong. Help us as we try to make the right decisions, the right choices to help the citizens of our city, our county, and our region. We must work very hard to ensure that they have the chances, the opportunities to work and play and support their families. Please be with us, Lord. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Dr. Miller. Under announcements, we have a special guest tonight, Ms. Susan Mathena, the Cancer Needs Assessment Project Coordinator for VCU Massey Cancer Center, and she'll come tonight talking about the findings of the Comprehensive Cancer Needs Assessment Project for the Pennsylvania Danville Health District. Welcome, Ms. Mathena.
Thank you for having me, Mayor Saunders and council members. I want to tell you about the Comprehensive Cancer Needs Assessment Project for the Pennsylvania Danville Health District. I'm sorry for reading this. This needs assessment was sponsored by the Virginia Commonwealth University Massey Cancer Center, which is located in Richmond, Virginia, and is funded by the Tobacco Commission. Massey Cancer Center is part of the Virginia Commonwealth University Medical Center, also known, or as we know it, as Medical College of Virginia. They changed their name several years ago. It is one of only 66 National Cancer Institute designated cancer centers in the country. It is recognized within those 66 as a leader in the research for prevention, diagnosis, and treatment of cancer. So it is on the same level as Duke, UNC, Wake Forest, and UVA cancer centers. We just don't hear that much about Massey down here in the South Side. Massey takes seriously its mission to outreach the entire Commonwealth, as shown by its sponsorship of the needs assessment and other programs that are reducing the risk of cancer and assisting cancer survivors throughout the state. I have provided you with bullet points of my speech tonight, and later this spring the full assessment will be available in print and on the Massey website. The Comprehensive Cancer Needs Assessment was designed to assess the cancer burden, the cancer medical resources, and community cancer support services in the health district. To accomplish this, we looked at demographics and cancer statistics from the Virginia Cancer Registry. We interviewed key medical leaders. We surveyed primary care physicians, conducted focus groups with the general population and with cancer survivors, and evaluated data from the Centers for Disease Control's Behavioral Risk Surveillance Survey. And tonight I'm only going to hit the high points of the needs assessment. Over half of our population is 50 years old or older. Since cancer is considered a disease of the aging, this demographic is very important when we are planning cancer resources in our community. And this assessment was for adult cancers only. We did not look at cancers that affect under the age of 18. Gastrointestinal, also most commonly colorectal cancer, respiratory, most commonly lung cancer, and gynecological cancer, most commonly cervical cancers, have a higher rate of incidence in our community than it does in the state. These 3 classes of cancer are frequently associated with behavioral risks, such as diets for colorectal cancer, tobacco use for lung cancer, and sexually transmitted disease for cervical cancer. 4 types of cancer cause 68% of all the new cases of cancer diagnosed each year in our district. These top 4 cancers are gastrointestinal, respiratory, female breast, because men can get breast cancer also, and male genital prostate cancer. Male genital cancer is commonly prostate cancer. There are an average of 700 new cases of all cancers in our district diagnosed in a year, 276 average cases. I think there was a misprint on your bullet points. It is 276 cases or deaths from cancer each year. This breaks down to 13 new cases of cancer diagnosed in our district each week and 5 deaths each week in our community from cancer. The key medical leaders in the focus groups acknowledge that lifestyle choices such as dietary habits, lack of exercise, and tobacco use are the causes of many of the district's health problems, including cardiac health. The discussion groups with the residents of the district revealed that most people do not know where to turn when they have questions on risk reduction and other concerns about cancer. Discussions with key leaders reinforced the residents' need for more information and on how to lower risk for cancer and on how to obtain care. Another big issue that both groups agreed upon was the resistance of the citizens and of physicians to discuss and access end-of-life services in a timely fashion. The end-of-life services would be hospice care and palliative care. Early detection of cancer is critical to reducing the death rates from cancer. There are effective screening tests for colorectal, breast, and cervical cancer, but just over half of our district's population is screened following screening guidelines. The focus groups admitted to not knowing enough about the guidelines for screening and of knowing very little about the signs and symptoms of cancer. The major reasons for the lack of screening, according to the key leaders, the physician survey, and the focus groups, were due to lack of patient finances. Yet, people are not utilizing the free screening programs we have available. The Pittsylvania Danville Health Department operates a free screening program for breast and cervical cancer called Every Woman's Life, and this is a state-supported and Susan G. Komen-supported program. In 2010, only 19% of eligible women in the district utilized this program. And this program will not only do the pap smears and mammography, they will also take care of diagnosis, full diagnosis and treatment if they start with the program. The district has several medical facilities for screening mammography for breast cancer and colonoscopy for colorectal cancer. These include private physician offices as well as Danville Regional Medical Center facilities. The diagnosis and treatment of most cancers can be performed utilizing the radiology, surgical, and laboratory and radiation services at the hospital and at private practices. However, once cancer is suspected, the district falls short in the number of specialized physicians needed to adequately serve our cancer needs. Focus groups noted that there was often a wait of several weeks for appointments for diagnosis, an agonizing time period for someone who knows they have cancer or thinks they may have cancer. And then once they get in to see the doctor, there may be a several-hour wait to see the doctor, and then if they're in treatment, it's going to be 5 hours to get chemo. These wait times are the primary cause of people seeking care out of town. In economic terms, patients leaving the district annually to be admitted to just the Virginia hospitals cost us $8 million in revenue. We do not have the numbers for the North Carolina hospitals, and we all know that people jump across the state lines very readily. All of this district's resources for cancer care are located within the city limits, which places a transportation burden on our county neighbors. But transportation is an issue even within the city. If you do not fall into the guidelines for meeting transportation criteria for the city-provided free services, say you're a middle-aged man who doesn't have family members in town but needs a ride cannot drive themselves to and from treatment because after treatment you don't feel like driving home, you may give up treatment because you don't have a ride. So transportation is a burden for everyone getting treatment. There are support services for cancer patients and their families in the district, some of which have been around for a while and others that have recently been established. The only fully local support service is the Danville Cancer Association. DCA operates on donations and grant funding to financially assist patients undergoing cancer treatment, provides aesthetic aids, and sponsors the only cancer support group in the area. The American Cancer Society sponsors 3 programs within the district, but does not have a local office. So these programs are only accessible by calling a toll-free number. Massey Cancer Center is meeting some of the needs found in the assessment through its recently established Cancer Resource Center of Southern Virginia. CRC distributes information packets to area physicians, facilitates cancer-related events across the Dan River region, coordinated through the hospital and the DCA, Danville Cancer Association, and the other cancer resources in the area, and is currently sponsoring a monthly seminar series and is in the middle of planning a survivorship conference. Connected by Cancer and Beyond, a program for survivors, will be held on May 5th, 2012 at the Institute for Advanced Learning and Research. According to focus group members, cancer research is another topic that most residents know little about. I had the opportunity to bust some myths about cancer research and clinical trials, and all of the focus group members were receptive to hearing about clinical trials and considering their participation in them. They do think that we need them available in this area rather than having to go to the larger cancer centers to participate in clinical trials. To summarize the priority needs uncovered in this assessment, the community needs education directed at prevention and lowering risk, and we could tie into existing programs on nutrition, diet, exercise, and tobacco cessation programs. We need community education directed at early detection of cancer through meeting screening guidelines. We need increased access to cancer screening. We need a patient navigation program to guide people towards early cancer screening, steering them through diagnosis, leading them to treatment, and directing them during follow-up care through resolution of disease. We need community support of and expansion of existing cancer support services, including increased awareness and use of the Coping Support Group, Danville Cancer Association, and Cancer Resource Center of Southern Virginia, and of the local hospice programs also. We need creation of new services, especially cancer-specific support groups, and of palliative care programs. The end goal of the needs assessment is to inspire individuals and organizations to develop and implement strategies that will meet the needs of the community. I am pleased to tell you tonight that Danville Regional Medical Center, responding to hearing the assessment early in November, is planning a patient navigation program. This is just the beginning of many projects which are still in the early planning stages. Massey Cancer Center has several on tap that you'll hear more about later. And it is critical that the community is involved on all levels in implementing and developing our own programs. Lowering the risk and the rate of cancer will only happen if the community at every level becomes involved. I'm available to speak to any group that you may refer me to. I'll be happy to come and give a program to them. And my office is at the Institute. If the audience can pick up a flyer, the same bulleted points, and if you forget my number, all you have to do is call the Institute and ask to speak to the lady who talks about cancer all the time. Okay. Thank you for your time.
Thank you, Ms. Mathena. We may have some questions for you, but let me first of all thank you for the information. I did read the bullet points, and it was very, very informative.
Thank you.
I think we all would agree that awareness can lead to prevention.
Right.
And you made that very clear. So thank you so much for your work in the Danville County district. Mr. Raleigh.
Yes, Ms. Mathena, the resource center,
Yes.
where is that located?
That is located at the Institute for Advanced Learning and Research. The office is there, yes. We do have office hours. Charlotte Litzenberg is the cancer resource person, and there are office hours on Tuesday. And it's always best to call. If you call the Institute, you can get one or the other of us.
Yeah, Mr. Shanks.
Yes, I too would like to thank you. The information here is very useful.
Thank you.
I'm very glad to hear that you had provided the information to Danville Regional, and they have already reacted with the navigational program.
Yes.
That's very exciting that you've
It is very exciting.
You've already influenced somebody just already.
Yes.
And your information is great. Just as a follow-up, Danville Regional also is a large supporter of the Danville Cancer Association. Their fundraiser, the Bridge to Bridge Run.
Right.
That's coming up, I believe, next month, or I think it's over the Easter weekend.
April 2nd? 7th, April 7th.
So I just thought I'd mention that while
Yes.
you were on the topic. Thank you very much for your
Thank
time.
you.
Thank you. Mr. Vice Mayor?
No.
Okay, Dr. Miller?
One of the saddest things we see in medicine is somebody comes in with advanced cancer, they suspected or knew might be there, and they didn't know where to get treatment, and they come in and it's too late.
Right.
We know that if they'd come in early in the game, they would have gotten treatment and perhaps been cured, ameliorated. So this is very important that this is out there now. Thank you for doing
Thank
this.
you. We're hoping to start a lot of the patient navigation program would do community outreach education. It would, the way I like to describe it is, I'm sitting in a booth at have a health fair, and somebody comes up and wants to talk about cancer screening. Instead of saying, why don't you call and make an appointment, I'm going to be able to make the appointment right then and there for that person. And that way, the person walks away with an appointment date, and then I would follow up with that person to make sure they show up.
Thank you. Anyone else? Two observations. One is you talked about our district. We know Danville, about 44 square miles, thereabout. Pennsylvania County, about 1,000 square miles, thereabout.
Right.
You talk about driving home after treatment. That is a problem.
Right.
In the city, we do have public transportation. In the county, we do not.
Yes.
So the need is there for volunteers and others to assist people who have a need for care for this dreaded disease. Another question, in reading your bullet points, somewhere it talks about only 2 physicians or 2 specialists in the Danville area that can treat certain...
We have 2 oncologists, Dr. Timothy Brotherton and Dr. Mark Farmer, who are oncologists. We have Dr. Peter Leiter, who is the radiation oncologist. Now, there is a part-time oncologist that has just come in with Dr. Brotherton, so 2.5 oncologists. There is a typical wait when you go in to see either physician, because both physicians take their times with the patients. You may wait in the waiting room for 2 or 3 hours to see the physician, but you know when you get back there, you're going to get the same level of care as the person that you were waiting because of. But it's very hard to wait that long when you are sick. And early cancer patients don't even feel sick. It's only after you've been through several chemos that you start feeling the wear and tear on your body. So.
And can you say again about the $8 million spent in Virginia versus North Carolina?
We don't know. We don't have the statistics for North Carolina hospitals, but the inpatient admissions to Virginia hospitals from people in our districts, people leaving our district to go to Lynchburg, to go to Roanoke, to go to any of the other hospitals, Halifax or Martinsville, cost our area $8 million. Okay, now...
Our area, meaning Pittsburgh and Danville alone?
Right.
$8 million?
Any resident that leaves the area to go to one of those hospitals as an inpatient, that's what we counted, was any resident leaving the district to go to a Virginia hospital outside the district. Their inpatient cost, the total inpatient cost was $8 million. Now, 55% of the patients in Virginia that stayed at Virginia hospitals did stay at DRMC. 44% went to other Virginia hospitals. But we know that that's not an accurate count because a lot of our patients go to Duke and UNC and Wake Forest.
Okay, and did I say, last question, okay. In the bullet point, something, a percentage of the palliative care of patients, a large percentage of those just being treated for it as opposed to prevention, certain kind of medication, in-house. It talked about palliative care, right?
Yes, we talked about palliative care not being available. There is no palliative care program.
Not available here.
Not available
Thank
here.
you. Okay.
And there again, the Legacy Hospital The Legacy Hospice of the Piedmont is developing a palliative care program. Hopefully they will have that instituted in 2012.
Mr. Shanks.
Yeah, I would suspect, and maybe you have some guess, but wouldn't you think with Duke and Chapel Hill, with the research going on there, that there's probably more going out of state than staying in state?
Yes, and our statistics people at Massey did not have access to the North Carolina numbers. And this was a big issue for me because I know that a lot of people go down there. So we can't look at we can't consider just the Virginia hospitals. I mean, I can count on both hands numbers of people that go across the line every week for treatment. So we are losing a lot of money from the community. And you're talking about employees that could be, if we had better utilization of our facilities, which we have great facilities at the hospital. So the people that go down there, if they stayed in here, then we could hire more people at the hospital and boost up our own services.
Thank you so much. Would you please introduce your partner,
Charlotte Litzenberg, who is a co-director of the Cancer Resource Center of Southern Virginia.
Welcome. Thank you so much. Under communication, those who wish to speak on matters not listed on the agenda will be heard at this time. If you wish to speak on any item listed on the agenda, you will be heard when that item is considered. Anyone wish to speak? Anyone wish to speak? Okay. Under minutes, approval of minutes for the regular council meeting held on January 17, 2012. Is there a motion? Dr. Miller. Is there a second? Mr. Raleigh. Discussion on the motion. Madam Clerk.
Reverend Campbell.
Aye.
Mr. Gilstrap.
Aye.
Mr. Jones.
Aye.
Vice Mayor Luther.
Aye.
Dr. Miller.
Aye.
Mr. Raleigh.
Aye.
Mayor Saunders.
Aye.
Mr. Shanks.
Aye.
Mr. Toma.
Aye.
Consideration of amending FY 2012 budget appropriation ordinance to provide additional funding for telecommunication regular capital maintenance by transferring $100,000 from the unreserved fund balance. Is there a motion? Mr. Shanks.
Yes, Mayor, I move for adoption of an ordinance amending the fiscal year 2012 budget appropriation ordinance to provide additional funding for telecommunications regular capital maintenance by a transfer from the unreserved fund balance in the amount of $100,000.
Okay. Second, Mr. Gilstrap. Discussion on the motion. Mr. Shanks.
Yeah, Mayor, I just want to take this opportunity. This is an appropriation of $100,000 that was not budgeted this past year to a fund that is performing very well in our Danville utilities. And the telecommunications generates an income that contributes to the general fund, and I think this is an excellent opportunity to keep this program growing. And the reason why we're in this problem to needing to allocate more money is the success that they're having with signing on new businesses like the Noblest Computer and providing access to the network through infrastructure improvements there and Gateway Alliance and the Danville Regional Medical Center. So this is a good problem, and it's a good kind of budget amendment.
Thank you. Further discussion? Madam Clerk.
Mr. Gilstrap.
Aye.
Mr. Jones.
Aye.
Vice Mayor Luther.
Aye.
Dr. Miller.
Aye.
Mr. Raleigh.
Aye.
Mayor Saunders.
Aye.
Mr. Shanks.
Aye.
Mr. Toma.
Aye.
Reverend Campbell.
Aye.
On the new business, I think that item has been pulled. On your desk, you'll see the request to pull that, so that will not be discussed tonight. And under item B, consideration of amending FY 2012 budget appropriation ordinance to provide for a grant in the amount of $12,103 from Virginia Office of Emergency Medical Services to purchase personal protective equipment for the fire department. Is there a motion? Mr. Campbell.
Mr. Mayor, I move for the ordinance amending the fiscal year 2012 budget appropriation ordinance to provide for a grant in amount of $12,103 from the Virginia Office of Emergency Medical Services grant program known as Rescue Squad Assistance Fund, RSAF, and a local funding in amount of $609 from the fire department operating funds for a total appropriation in the amount of $12,712 and appropriating the same.
Okay, second by Mr. Vice Mayor. Discussion of the motion. Discussion on the motion. First reading. Three, amending FY 2012 budget provision ordinance to provide for funds from Commonwealth of Virginia in the amount of $40,000 for a domestic violence victim program grant. Mr. Jones.
Mr. Mayor, I move we adopt an ordinance amending the fiscal year 2012 budget appropriation ordinance to provide for a grant from the Commonwealth of Virginia for a domestic violence victim program grant in the amount of $40,000 and appropriating the same. First reading.
Okay, second, Mr. Raleigh. Discussion on the motion. Discussion on the motion. First reading. Three, amending the FY 2012 budget appropriation ordinance to provide for a grant from the Library of Virginia in the amount of $10,019 for the purpose of preserving circuit court records. Is there a motion? Mr. Raleigh.
Mr. Mayor, I move that we adopt an ordinance amending the fiscal year 2012 budget appropriation ordinance to provide for a grant from the Virginia Circuit Court Records Preservation Program in the amount of $10,219 and appropriating the same for first reading.
Okay, is there a second? Mr. Shanks. Discussion on the motion. Discussion on the motion. First reading. Communication, Mr. Manager.
I want to thank our employees. They did a great job at dealing with the snowstorm this weekend, particularly Public Works, but also Public Safety, Utilities, Emergency Management, all the employees behind the scenes that work on in these circumstances. I think Council would agree they did a great job, as they always do. Thank you.
Agreed. Thank you. Mr. Attorney.
I want to congratulate the GW men's basketball team for a big victory Saturday night over Brook Point, and wish them luck as they tipped off 30 minutes ago at Osborne High School in Northern Virginia.
Okay. Madam Clerk.
Nothing, sir.
Okay, please call the roll.
Mr. Shanks?
I, too, would like to follow up on Joe's comments about Public Works and the various city departments. Did a great job. It was a short event, but it got taken care of very quickly, and the city employees did a great job. Also, I wanted to take one more opportunity, Mayor, to ask that City Council reconsider its instructions to the city manager regarding the upcoming budget, the instructions we gave the manager just 2 weeks ago at the work session. These instructions did not include a plan of any notable expense reductions, but did include substantial spending on numerous projects, some of which were just added last year, projects that were funded not by current year revenues, but funded by balance transfers. It has been well publicized over the last week or so that an additional school may have to be closed unless City Council makes up roughly $2.5 million to transfer to the school board. No forethought has been given to an austerity program, yet with the current instructions to the city manager and the approach that Danville Public Schools is making towards the budget, council will be in a very awkward position of making the final decisions whether to make a substantial tax increase or to close a school. There likely will be even more draconian cuts necessary in order to, in other areas of the city budget. And we have not looked at ranking any priorities or looking into any of the numerous non-essential government services that could be cut. There's been no discussion of cutting expenses and no discussion of what programs could be reduced, delayed, or eliminated. It is totally irresponsible for us as a city council to consider a tax increase without first looking under every rock, even the big ones, for ways to cut expenses. Businesses and citizens, families have spent the last three and a half years adjusting their lifestyles to live within this economy. I don't think that we have done everything we need to do to bring our expenses in order. So I hope we can work together and reconsider what instructions we've given the city manager, because there are families and businesses out there hanging on, just waiting and trying to get through this current economy. Thank you.
Thank you.
Mr. Tomer?
Yes, I want to say that I'm very fortunate today on my birthday to have the two beautiful ladies in my life come and my daughter to see her first council meeting. And she's been pretty quiet back there. She must take after her mom, because if she was like me, she'd probably be raising Cain in the back, but that's all right. I just want to say that I'm glad to have them here, and I agree with a lot of things that Councilman Shanks said. I think we've got some hard decisions coming up with this budget, and once again, we're faced with some things that are going to be tough pills to swallow one way or the other. I do know that this council is committed to doing what we think is best for the city, but we're all going to have to come together and make some compromises and maybe go in some uncomfortable places that we haven't gone before. So just be prepared for it. It's not going to be an easy battle. It'll probably be more difficult than it was last year, and rightfully so. We've got a lot of people dependent on us. That's all I have to say. Thank you, Mayor.
Okay. Reverend Campbell?
Yes, today, Councilman John Gilstrap and myself, we sat in on a steering committee meeting for the George Washington High School multi-purpose stadium initiative that will be going forth. This will be an 8-track lane plus AstroTurf. It's an exciting time, and we're asking that the community corporations would engage in this process that will make George Washington Stadium one of the best within our region. We realize that this can be a strong economic tool of the have major track meets here and other initiatives that will be very positive for the growth of our community. Thank you, Mr. Mayor.
Thank you.
Mr. Gilstrap?
Nothing. Thank you.
Mr. Jones?
Mr. Mayor, I feel like I'm the happy guy to bring happy news again. There was a young man that came back to Danville. Philip Hayes, Jr., returned back to Danville. He's now working at Nobles Center for Applied High Performance Computing, and I've talked with him on this weekend, and he's very happy to be back in Danville. Just to piggyback on some of the things that's already been said, I immediately called Dr. Davis after the email we received about W. Townsley closing. And Mr. Mayor, after talking with her, I asked Dr. Davis how did it go, and she said there were a lot of tears at W. Townsley. I just hope that we can do everything we possibly can, as Mr. Shanks stated. Mr. King, one of the conversations that keep coming at us is that why are we building this and why are we doing downtown and we're closing schools? In a couple of weeks, we have several of us have to be at W. Townsley for a reading, Dr. Seuss reading. And I contacted one of the teachers from who invited us today, and I asked her, is it safe for us to come? So I just asked that the whole entire community, we pray for the Danville public school systems and anything that we can possibly do. Let's look on the, as Mr. Shanks said, under every rock that we possibly can, because Danville public schools have already cut 81 positions over the reduction in force. And whatever we need to do, I hope that we all together can do it. Thank you, Mr. Mayor.
Thank you.
Vice Mayor Luther?
I'd like to point out that half of the Tummer family slept through the whole meeting. But people who watch this on TV say, my goodness, your meeting was only 35 minutes long. You know, there's nothing to it. The meeting we have coming up, we'll be lucky to get out by 10:30 or 11. As everybody's alluded to, budgets, problems, everybody apprehensive about what's going to happen. We've been really good at getting input from the community, but it's going to be tough. As long as it's going to be tough to keep another school open if it means shutting down a fire department. I mean, we've got some tough things to decide, and we've got to put them all on the table and let the public see them and let everybody comment and do as everybody said, what's best for most people. But this is a short meeting in here. I kind of wish the cameras were in the other room. That's all, Mr. Mayor.
Thank you.
Dr. Miller?
I've heard of getting started early in politics, Adam, but I think this is a little bit much, but she certainly is cute. In the Richmond paper this week, I was noticing that they're wrestling with the same problem. Their city council is looking at closing 3 out of their 29 elementaries. Chesterfield County a couple of years ago cut several hundred teachers, closed some schools. That's a pretty affluent county, and now they're looking at 30 and 35 kids in classrooms. I don't think we want to go there. I'm hoping we won't have to pare our schools down too much. And I think everybody agrees we have to look at things and trim as much as possible, but it comes to a point where you've trimmed as much as possible, and to think that we're going to get by without some kind of real estate or property tax increase, I think it's just putting it off. We put it off last year. I think it would be a mistake to do it again this year. It's going to take a combination of things. I think we can trim and trim and trim. At some point, people are going to say stop. And we're going to, unless we want to close schools and fireplaces and libraries and everything. The cities can only make so much their money from limited places. Our assessments of our houses are going to go down. And the estimate is it's going to cost us maybe $1 million. If we, at the same tax rate, if the assessments go down, the city collects that much less. Probably $1 million more we'll have to make up. We're going to have to, I feel, raise the real estate tax somewhat just to get back to level, to get back where we were. I know some people draw a line in the sand and don't increase taxes at any cost. I think that's, probably unrealistic. And as far, I think the downtown is a very valuable thing. This is to try to get the city to grow. We saw a nice presentation about the streetscapes last week, and they'll be presented to City Council, I think, in a couple of sessions from now. This is the way to go to try to attract more people into the community. If somebody comes here to see downtown, they might just shop, not just shop downtown, they might go out and shop elsewhere, go to a movie, etc. So it benefits the whole city if we build something for people to come to. So I think we need to continue on that path. And that's the way I see government. I think government needs to provide certain essential services, police, fire protection, schools, education. And the seed, I'm sorry, I just don't believe private investment would renovate the downtown on their own. They have to have some input from the city or the governments to provide the initial nidus, and as things, if you build an attractive downtown, then private industry will come in and rush in to add to it. There's already some new shops that say, and restaurants that are going to come downtown. But if we didn't get it started with government, it wouldn't have gotten done. The downtown wasn't going to get renovated by private enterprise alone. So it takes a combination. That's the way I see it works. Government provides essential services, provides the seed money or the seed structures, and then private enterprise does the rest. So I think we've got some hard choices. I hope we don't have to close any more schools than we have to close. Thank you.
Thank you.
Mr. Raleigh?
Mr. Mayor, I had heard this weekend about the committee that had come together that Mr. Campbell talked about. And over the last 8 months, Averett University is looking at identically the same thing. A new football stadium, field turf, a new track program, a new women's lacrosse program, and I'm hoping, I'll be calling Mr. Lewis in the morning, and I hope there's some kind of synergy that we can do together that could benefit both people and not duplicate too many services. So I'm anxious to talk and see if we have anything that we'll have in common to talk about. Thank you, sir.
Thank you.
Mayor Saunders?
Well, everyone's surprised. Thank you for all that you do. And thank you, Ms. Mathena. And to our city employees, thank you again. We appreciate that. Meeting adjourned.